Hi, so I got lab results back, most of them. There's still a couple that I think are on the way from when I had almost 20 vials of blood taken from me the other day, which I survived. And as I expected, they're pretty much all normal, which is, I mean, it's good on the one hand, but on the other hand, it's all frustrating because then the doctors just think I'm being crazy, but I'm not. Well, maybe you think I am, but that's okay. So I'm going to share my screen here, just go over them a little bit. Also, for those of you who want a little bit of advice on going over your own lab results. So here's all the June 14th, 2021 was when the labs were drawn. And as you can see, there's quite a lot of them. And then prior to that, I'd also had some tests done. Anti-nuclear antibody and rheumatoid factor is to see if I have autoimmune, which I do not. These have both been negative, and this other doctor actually tested them again just to be safe. I told her they were negative, but she said it can change. So she tested them again. They're still negative, which is good. I don't have rheumatoid arthritis. I had an x-ray of my hands taken, and the x-ray was normal. No fractures, normal bony mineralization and alignment, joint space is maintained, no focal soft tissue abnormality, no significant osseous abnormality. So basically, in short, no osteoarthritis, which is good news, but that still doesn't explain why I'm waking up with my hands stiff and sometimes feeling like they're in rigor mortis. So going back to my test results here. This doctor that I spoke with when I was having the flare over the weekend, she was super nice and very attentive, and she just went to town, which I appreciate. I had been tested for Lyme multiple times, and that has been negative, but I had not been tested for Babesia or Borrelia, which she thought would be a good idea, and those were also negative, at least in terms of the antibodies. So part of this is, and this is where these Lyme doctors might disagree with this. They'll say, well, that might not show that maybe you didn't develop antibodies, but you still have it. That's kind of controversial, but at least from a mainstream perspective, I do not have Borrelia or Babesia. My uric acid is well within the normal range. And so I do not have gout. This is not even slightly high at 2.9. I'm not a doctor, but I can pretty much say confidently that I do not have gout. And I will also further explain why that is when I look at my urinalysis, which is basically the only thing that is even slightly abnormal. And the urinalysis shows that my urine pH is very high at 8, which means it's alkaline. And if I had gout, it would be more likely to be acidic. So gout's really not on the menu. I'm going to ask my primary care physician about pseudo gout, which is where there are some little crystals, but they're calcium phosphate based, or it's pyrophosphate. I might be getting that wrong, instead of the uric acid crystals that form with gout. So maybe that's what's going on. And it kind of comes and goes, because this pH here at 8 means that my urine is a little too alkaline. Now, see, this is where people might argue. They go, well, look, the standard range is between 5 and 8. But yeah, this is at the top. It's at exactly 8. Could it possibly be maybe even slightly leaning towards 8.1? Is there a particular point between 8 and 8.1 where suddenly it becomes a problem and we shouldn't be concerned? The thing with the urine pH and it being so alkaline is that they do know, I did quite a bit of research on this because this is the only thing that I found that might possibly be related to how I'm feeling, because everything else was, once again, I said was very normal and actually good, and that my inflammatory levels are low and whatnot. There's a big trend right now about people going on alkaline diets and that it's better to be alkaline than acidic. Well, this is kind of an oversimplification. So our body pH is in a very narrow range, and it's the close to 7.4, but it can go a little bit below and a little bit above And I don't have the exact number in my brain right now, but it's somewhere around that. You should look it up to verify, because I could be wrong on that exact number. And it doesn't really deviate far out of that range. If it does, then you can get very sick and die. So the idea that you want to be alkaline or overly alkaline, I guess, is not really an accurate way to describe what is healthy and what isn't healthy. So technically neutral is 7 on that pH scale. So our blood is slightly alkaline. When it gets lower than 7, it becomes acidic. Our urine actually tends to be more acidic. And part of that is because we're getting rid of certain things from the body. And that's why the acidic, now, unfortunately, as I'm doing this video, there's some sort of maintenance going on. I'll try to reload. So the short version is that if you have acidic urine, that's not necessarily a bad thing. If you have urine that's too alkaline, that could actually mean that your blood is actually too acidic because your kidneys are not processing the acids, and that's why your urine is alkaline. Does that make sense? I can actually, I was able to reopen this. So let me explain that again. This is definitely in that range where the doctor might just roll his eyes and say, oh, that's no big deal. But the integrative doctor, the functional doctor might say this is an issue. But let's just pretend for argument's sake that it's 8.5 and not 8, and that it's consistently testing very high. One of the things that they would look for is a kidney issue where your kidneys are not processing the acids, and there's too much acid that's staying in your body and is not getting peed out, as it were. So you definitely don't want to have consistently super high urine pH. pH over 7 of your urine could potentially make you more prone to crystals in your urine. And those crystals are calcium phosphate, which from what I'm seeing, I've only done a little bit of research on this, and I'm not a doctor, so take what I say with a grain of salt. The calcium phosphate crystals sound kind of similar to me to the calcium pyrophosphate crystals that you might get with pseudogout. Now, that might not correlate at all, because this is what's in your bladder, and that's not what's, this pH is in your bladder. It's not necessarily in the rest of your body. Obviously, if you had a pH of 8 in your blood, you'd probably be dead. So it may have nothing to do with anything. I tried to look it up, see if there's any correlation, and there was nothing that I found on it. But it is definitely related to calcium and phosphate. And I happen to have a phosphorus deficiency, phosphorus, which I had been put on an AV for a couple years ago. So there's some little things that have been off with my body. Anyway, so I'm going to be talking to my PCP. I'm going to ask him about this pH thing. He's probably not going to take it very seriously. But I do want to get just at least some conversation going around this, and maybe test it again, which I can do with some pH strips that I can order online and do this at home, and check my urine every morning to see if it's consistently 8, if it's lower, maybe during my symptoms, my pH in my urine is consistently higher, maybe that means something. Now, the other thing that it could be related to is there's something called respiratory alkalosis. And that is when you have a little bit too much alkaline in your system. And what was interesting to me is that those symptoms actually are very similar to the symptoms that I have, particularly when I'm trying to sleep. You get tingling, you get numbness, you get paresthesias, you can get dizzy. If it gets very serious, then it's very serious. But is it possible, which I'm going to ask my doctor, and he's probably not going to, I don't know, maybe it is a decent theory. They usually don't take me seriously, because I think, like I said, because I look so healthy on my labs, they probably just think I'm a neurotic. But if you're breathing too much, hyperventilating or over breathing, which a lot of people do, then you can go into this respiratory alkalosis, if I'm pronouncing that right. And the question that I'm having is, when I'm sleeping, is it possible that while I'm asleep, because of the trauma that I went through when I got sick, or maybe some lingering infection that's putting some stress on my body, am I possibly breathing in such a way that is putting me into a slight state of alkalosis? And that's why I'm waking up with my face vibrating and I'm getting twitching and stuff in places. That would actually make sense to me. Whether a doctor takes that idea seriously, I don't know. What can they do about it? Not much. What can I do about it? Quite a bit, because I can do more holistic stuff. And these symptoms have been calming down as I've been getting better and have been, doing my qigong and my practices and whatnot. And I will say that when I go to sleep, sometimes I do have this feeling like there's a pressure on my chest, like I'm not unable to exhale completely. I've never really smoked other than a couple times, a little bit of marijuana in college when I was socializing with people. So I can't imagine that my lungs would have something like COPD. But when I had my X-ray done of my heart last year, when I went to the ER because I was dizzy and felt like I was going to pass out, my lungs were a little hyperinflated, and that hyperinflation can cause this respiratory alkalosis because you're not able to breathe out the carbon dioxide and breathe in the fresh oxygen. Or maybe that's acidosis. Anyway, it affects the level of your pH in your blood when you're not breathing in and out correctly. I could have the exact mechanisms wrong. So, but they said it could just be that I was kind of holding my breath in when they were doing the X-ray. They didn't really think too much about it, but it was noted on my X-ray that I had a slight hyperinflation of my lungs. So I'm going to work with this theory, whether the doctor thinks it's crazy or not, that maybe I am not breathing well when I'm sleeping. I used to have night terrors when I was a kid, and I would wake up screaming and whatnot. And there's just a big likelihood that there's still a lot of stress in my body from everything that's happening. So last night, as I was falling asleep, I would wake up and I'd go, oh, I'm not, I need to go back to sleep. I would just start doing long, slow, deep breathing. With this type of alkalosis, breathing in and out through your pursed lips can actually help with it. And I actually find that that does help me. These moments where I feel like I can't get a deep enough inhale or exhale, that helps a lot. The other thing that actually has helped me in the past, particularly when I've been falling asleep and I had this feeling like my chest kind of felt a little constricted, and I was thinking maybe this is just some acid reflux or something, I don't know. Stair step breathing, which is from yoga, where you it's good for anxiety. You don't breathe in all at once, you do sips, like now. Interestingly, when I had my consultation with Carola last month, and they said I had too much vata, Dr. J said, I really want you to do some alternate nostril breathing, like 15 minutes a day, or at least 5 minutes a day. And so I said, okay, yes, I'd get that started. And then of course, as a vata person would, I have been like really remiss on doing my daily alternate nostril breathing. But I did do some last night before I went to bed. I was just right in bed. I did a little bit before I fell asleep. And I woke up during the night and I tried to do a little bit of that pursed lips breathing. And I seem to feel a little better, more rested this morning. So I'm going to play around with that and see what happens. I'm also going to get checked out by my OBGYN, because even before I got really sick, I had this weird pain down in my lower right quadrant, which I had been worried, is it my appendix inflamed? Do I have an ovary that's whatever? And just to make sure I don't have maybe some asymptomatic PID or STD or something. I looked it up. Gonorrhea can cause joint pain if it's not treated. And I'd hate to think that it's very possible that I caught that a long time ago and nobody ever caught it. And it's just kind of like some weird, I don't remember seeing that on any of my labs. So that's probably negative too. One more thing, I just wanted to go over vitamin D real quick, because a lot of people talk about vitamin D lately. So vitamin D. I'm running through this through you. It's, I'm talking about my own case, but when you're looking at your own labs and talking to doctors, trying to do research and seeing like what might be correlated with, this is not loading, what might be correlated with some of these lab results. And you're going to have, I got to sign in again. is a good way to at least get some idea of what might be going on. And most of the time, you're going to come up with the wrong theory. I certainly have. I've come up with maybe it's gout, maybe it's this, maybe it's that, and then I'm wrong. But I'm also removing things from the possibility. And there, you know, when I was first sick, I actually kept telling my first, actually my second neurologist, I said, I think I might have POTS because of my symptoms. And he wouldn't have tested me if I hadn't mentioned it. And he said, you know what? Because I turned out I did have POTS. And POTS might be related to me not breathing right when I'm sleeping. And he said, oh, I wouldn't have tested you if you hadn't brought it up. I wasn't even thinking that. So it was a good thing you brought it up. So even though you're going to have some doctors roll their eyes, your friends and family members are going to roll your eyes when you talk about this stuff. It's, this is your health. So why worry about, I got tested for COVID, didn't have that. Okay. Why worry about what they think? You just want to feel better. Okay. Vitamin D. So I have 2 vitamin D tests here. This is what's confusing about this. This is 25 hydroxy vitamin D. It's 41 nanograms per milliliter. And this is in the normal range. However, you will see people saying maybe it's better if it's a little higher than this. This is, with any Western mainstream doctor, they're going to say this is great. I have read a study where people who had fibromyalgia found that when they increased their vitamin D, because there's some research indicating that fibromyalgia, which I have not been diagnosed with, at least yet, if I have this continued unexplained pain in my joints, maybe they will, but the vitamin D deficiency might be correlated with fibromyalgia. And so they did a study where they put fibromyalgia sufferers on vitamin D, and they found that there was some relief once the vitamin D got up to normal, but they had even better results once it got over 50. So maybe I need a little bit more, but this is what I was thinking when I first saw this. At 41, maybe if I got up to 50, I'd feel better, even though this is normal. But then today, my second vitamin D test came in. And this one is dihydroxy vitamin D. So that's different than the hydroxy vitamin D. And this is PG instead of NG. I'm not actually sure what the PG is, but this is 58 PG and the standard range is 18 to 72. Most of that is coming from the D3, as they say here, is D3 indicates both endogenous production and supplementation. That means I went out in the sun and I got some vitamin D. D2 is diet or supplementation. So most of my vitamin D is apparently coming from my being out in the sun, which I have been doing very consistently for the past month or so as it's warmed up. When I look at this level, I'm thinking, do I really need more vitamin D? Because this looks pretty good to me. Now, I did some preliminary research on the internet, couldn't really get some straight answers about much of this other than this type of vitamin D is what's bioavailable as opposed to the other stuff. This is what your body can use, I guess. Please double check that because I'm also doing this from memory. I could have some little details wrong. So do I really need more vitamin D in terms of the NG reading if I have this much bioavailable vitamin D? Maybe not. So just be sure, because you'll read a lot of articles that'll tell you that your vitamin D levels need to be this range, and they don't give you the exact reading or the exact type of vitamin D. So if you get a test that is dihydroxy vitamin D and your reading has a PG instead of an NG and you're at 58 here, but you're at 12 there, not that you would be, that's very different than what people are recommending online. And so there's, I think, quite a bit of confusion, and I'm still confused. I really know. But I will tell you, generally speaking, that in terms of dietary supplementation, the safe upper limit that even mainstream sources agree on is 4,000 IUs per day. Now, if you're in the UK, you don't use IUs, but you can convert IUs to what I think is milligrams or whatever they use in the UK and the other countries. I see a lot of people just willy-nilly going, go and take 50,000 IUs at once. You don't need that unless you have a serious vitamin D deficiency, and I would not overdose on it just because you suspect that you need it or you think it's going to protect you against X, Y, and Z. Vitamin D, anything in excess, doesn't matter, water, whatever, it can make you sick. So, and I recently said this somewhere on a comment section because there were people, going on about high doses of vitamin D. And I just said, be careful. If you do too much vitamin D, it can actually cause some nerve damage. This was according to my neurologist that I had in Austin, who I respect very much. He said it's reversible. But if you have too much B6, that can cause irreversible nerve damage. And people just have this idea that because it's a supplement and it's not a prescription drug, that you can take super high doses of things and it's completely safe, and that's really not true. So you just want to be careful. But if you do 4,000 IUs, that's probably okay. But you should check with your doctor, obviously, and not listen to anybody on the internet without really vetting the information, including information from me, because I'm just some lady on the internet. What do I know? Okay, so anyway, so that's my hopefully helpful to somebody somewhere. But mostly I just wanted to make that comment about the pH, that don't just think you need to alkalize yourself. You might actually already be too alkaline. And I will learn more about this and experiment with my breathing and see what happens. And then also find out if there's any other possible cause. And other than that, I'm going to start taking my new Ayurvedic herbs that I need to order tomorrow and work on it Ayurvedically and holistically. So thanks for watching. Let's see if I can turn this off. Bye-bye.